You want to get your hair back in 6 hours? I'm Dr. Rob Bear in Newport Beach, California, and I'm going to show you how. Who am I here with?
With Ethan.
What made you want to get a hair transplant?
Honestly, I've been considering it for a while, but in these last couple of years, my hair's been, falling out. And I'm just honestly tired of wearing hats. Wearing a hat every day for my day to day, I've been getting, pimples on my head, and I'm just tired of wearing hats, honestly.
The plan for Ethan is to do 2,000 grafts. We're going to focus on the front half. If you want to come a little bit closer, we just drew a very natural and artistic looking hairline for him. And we're going to jam pack as many grafts as we can in the front, give him maximum density, work on the corners because Ethan is still very young. We want to give him a youthful looking hairline, and we're going to go up to the middle part. This is your new hairline. If you want to take a look and let us know if it meets your approval.
Looks good. Looks very natural.
That's the whole purpose of it. We don't want people to know that you got a hair transplant. So it's going to look very natural and it mimics your natural born hairline. All right, we're going to get started. So for Ethan, we're going to do PRP. Ethan still has some native hair, so we want to protect that. The purpose of the PRP is to protect the native hair, but also the reason we do it during the hair transplant is to expedite the regrowth of the transplanted grafts. Once we place them in, they kind of go into hibernation and they take a few months to regrow. With PRP, it expedites the regrowth, but it also works like natural glue because it has wound healing growth factors, so it allows to hold on to the transplanted grafts better. What kind of fade do you want?
Low taper.
I just finished extracting 2,000 grafts from Ethan's donor area. Some other places, they use a robot or a hybrid machine operated by a technician. In my practice, I do all the extractions myself manually by hand. And we're very transparent about the number of grafts as well, and we'll show you the grafts in a second. It's very easy for someone to tell you 2,000 grafts and just extract and place 1,500 grafts. So we're 100% always upfront with the number that we recommend. If we get anything extra, it's on the house. How was this part of the process like for you?
Honestly, I didn't feel much. I had a nice nap during it too, so.
Perfect.
Yeah.
A lot of patients are worried that this is a painful procedure. So during the extractions, did you feel any pain?
During the extractions, no. Just the initial injection, I felt a little bit, but then after that, pretty pain-free.
I'm gonna show you the donor area first. So these are all the tiny little spots where I extracted the grafts. And I like to use the smallest size punch possible. So once this recovers, you will not see any scars at all. And you won't be able to tell that you actually took out 2,000 grafts from your donor area. And I do it in a special pattern that allows me to go back in if we need to do a second procedure. And if you want to see, these are all the grafts. So if you want to take a look, these are all your grafts. You got 2,000 grafts in there. You got a little bit extra on the house, but we're very upfront about the number of grafts. Feel free to count them as well. For the next part, what we're gonna do, we're gonna numb you up top, and then I'm gonna make all the sites and then place the grafts. Are you ready for part 2?
I'm ready, let's do it.
I just finished making all the sites so we can place the grafts. How was that part of the process for you?
It's very painless, and I got one of my favorite movies on too, so, experience has been great so far.
For this next part, I'm going to inject the PRP.
Okay, great.
Okay? Any pain?
Nope.
We just finished doing 2,000 grafts for Ethan. How was your overall experience getting your hair transplant?
Honestly, last night I had trouble sleeping. I was pretty nervous going into it. I was doing a lot of research and, obviously very nervous, but, came in, staff here is great. And the whole process was very pain-free and went by pretty quickly. So, yeah,
You have pain now?
Nope.
Go ahead and take a look at your new hairline.
Oh wow. Hairline looks good. It looks super natural.
So what we did is we recreated your own natural hairline, how it looked before you started losing your hair, looking at some of your old photos as well. And we made it very youthful. We brought the sides a little forward as well and made very masculine, sharp corners. Very common problem that I see when I do repair work is that a lot of places overseas or even here locally, they curve the hairline in the corners, and that's typically a female hairline when it curves like this. So for a male, you need those sharp corners. We put a lot of density in the very front, and then we went all the way up top. Halfway through, 2,000 grafts. Now it's just a matter of a few months for the hair to start growing. We did PRP today, so that's going to expedite the process. And if you want to actually take a look at the donor area, it looks really, really, really nice. Within 2 weeks, you won't even be able to see anything. A little bit of scabs the first few days, and they'll start falling off shortly. And at the 2-week mark, the hair starts growing, and nobody will be able to tell that you had a hair transplant done looking at your donor area. Are you happy?
Very happy.
Satisfied?
Yeah, no, it looks
You want to
really
do it
good.
again?
I honestly would. Yeah, I need to get the crown done.
Yeah, so we can work on that. All right.